I want to thank you for taking time out of your very busy schedules to join us this afternoon to talk about specifically the reporting requirements in Chapter 300, which have to do with the organizational data that we are collecting and started to collect last year. So just a couple of housekeeping items before we get into this. If you could keep your lines muted during this discussion, that would be great. If you have questions as we are going along, please pop them in the chat and we will stop, sort of after each kind of key section and try and answer any questions that come up. And then of course, at the end, we'll have time for questions and comments, and anything that we can't answer today on the spot, we will pop into the FAQ that we've developed and circulate that to folks. So with that said, let me just jump into a quick review of the agenda. We want to go over the requirements in Chapter 300, then talk through this annual validation of the organizational data, timing and next steps, and then address questions that you might have. And joining me here today are several of my colleagues that are folks that work with this stuff and work with many of you, I'm not going to say on a daily basis, but on a frequently. So Kim Bonson with the Maine Health Data Organization, Deborah Dodge, and Melissa Hillmeyer with our data vendor, HSRI. And I'm going to walk through the next few slides, and then I'm going to turn it over to Melissa, and she's really going to get into the substance of today's presentation. And both Kimberly and Deborah will also be available to help punt with questions. So with that said, Melissa, if we can go to the next slide. So just quickly, I think all of you by now are familiar with who MHDO is. We are a state agency. We're responsible for the collection, validation, storage, management, public reporting, and release of healthcare data. And we collect claims data, hospital inpatient and outpatient encounter data, hospital quality data, hospital financial and organizational data, which is what we're going to talk about today, specifically the organizational data, which is governed by our rule Chapter 300. Next slide. So if you're interested in looking at, if you haven't reviewed Chapter 300, you can find that at the link at the top of the page. And you'll see that, again, this rule governs the submission of financial data, which is a process where on an annual basis, no later than 6 months after its most recent fiscal year end, every hospital parent entity must submit financial data for its subsidiaries and or affiliated healthcare facilities. And then the second part of Chapter 300 is the organizational data. And again, that's what this session is all about. And in the rule, the requirement is by April 30th of each year, you are required to review, update, and then certify that the information is accurate as it can be based on your understanding. And obviously, we are going to move that deadline out. So we'll get into that, but it is not going to be due by April 30th. So we'll talk about that more in a minute. But we are eventually going to need to get on a cycle where, we are following the rule, which is April 30th. But, last year was our first year, and many of you just finished that review. And we needed time to get all of the updated information into the portal, etc. So we're a little bit behind. So we will extend that out for this second year. Next slide. So the hospital organizational data that we collect through this rule supports the development of our provider directory. And the provider directory that we are developing will contain provider identity information, and information about organizational relationships to a facility and a health system. And the directory will include the provider by provider type, specialties, credentials, demographics, service locations. And I think one of the important pieces of information that many of our end users of this data, which includes a lot of hospitals, are looking for is how the relationships, sort of the organizational relationships of how a physician practice fits within a structure of a hospital or a system, and how everything rolls up. So this is, you know, part of the information that you guys are reviewing and validating and or providing. And it is information that isn't just sitting in a black box somewhere, but this is information that people are using as they use our data to address various research questions and or, you know, policy analyses that folks are doing, looking at the data, et cetera. Next slide. So the requirement in Chapter 300 is this annual validation of the organizational data. And as I mentioned earlier, 2022 was the first year that we released this information, and you all reviewed it and made updates to it and then validated it. Remember that first year where we pre-populated the organizational data, that came from information that we get in data submissions from our all payer claims data, from the hospital encounter data that we get. And then we also supplemented some of that data with what is in NPES. The data that's in the portal today reflects the most recent updates and validations that you all have done. And so it is hard to believe time is marching on too quickly, but it is now time to revalidate and make updates as appropriate to the information in the portal. And so again, the rule says April 30th, we're going to push that out to May 31st. And, you know, hopefully it's going to be a lot easier because I feel like we now have a really solid baseline based on the work that you all have done. But if you have, you know, some concerns with meeting that deadline, you'll need to reach out to Deborah Dodge, which I think many of you know Deb, and we can provide her contact information if you don't have it. Deb, maybe you can pop that in the chat. To request an extension. I'm just going to say, you know, we want to work with you. We understand that you have a lot of other competing priorities. But on the other hand, you know, I just want you to be aware that this data is being used. So, you know, the more we can stick to that May 31st deadline, the better. But again, we also recognize that, you know, things happen, and if you need more time, we want to work with you on that. Okay, next slide. So just, you know, real quickly, after the information is verified by you all, then we're reviewing it to ensure that there's uniformity and consistency. We're looking to make sure that there are MPIs and primary taxonomies for each entity. We're looking to, you know, make sure the date that we had plugged in just as a, you know, fill date when we pre-populated for the physician start dates was 1/31/2022. Most of those dates have been updated to reflect the actual start dates. But if we saw 1/31/2022, you know, we may reach out to you to make sure that that either is accurate or if it needs to be updated. That the entity names appear correct, and that there are no additional notes listed. And you will note that there's a comment there if an entity name is incorrect. We're asking that you do not change the name to entity name /delete. Instead, we're asking that you update in the portal or you contact the MHDO help desk for assistance. And Melissa and team can get into answering that in more detail if folks have questions on that. Okay, and then I guess the last point before I turn this over to Melissa is that there are a few of you where we have some specific questions that we want to bring to your attention. And so following this webinar, we will be emailing you individually with some of those questions. So just wanted to give folks a heads up. And then I think at this point, next slide, I am going to turn it over to Melissa.
Thanks, Karen Lee. So based on the feedback that we've received during the first year's validation process, we've made a few enhancements to the hospital data portal that will hopefully make the review and validation process easier for you. So first and foremost, we added additional options for deleting a practice. So that includes steps for identifying if the practice relationship is not correct, meaning the nesting is not accurate, if the practice is a duplicate, if the practice closed, or if it was added accidentally. And we'll get through some of those specifics in just a minute here, but that was one of the enhancements that we added to the portal. Secondly, we added the ability for a health system, parent entity, or hospital to request a deadline extension through the portal. So while Karen Lee said you're certainly welcome to reach out to Deb or the help desk, there is functionality within the portal that allows you to complete a form to be able to request a deadline extension. And as Karen Lee mentioned, MHDO will not be authorizing lengthy extensions as in the past. And that particular feature also for the request needs to happen at the highest organization structure level. Again, we'll show some screenshots in just a minute. And then the third enhancement that was made to the portal is there are certain practices that are within the portal that are not required through the current rule to be validated. However, it's helpful to keep those particular practices within the portal from a relationship purpose and to be able to see how the nesting works within the organizational structure. And so there's certain entities such as skilled nursing facilities, home health agencies, respite care, that those taxonomies are used and indicated now as optional within the portal. And so, while you don't need to make them compliant, we do encourage those particular facilities to stay within the organizational structure and to not delete them. Again, they're optional to validate based on the current rule. In terms of the data elements to validate, no additional data elements were added. Again, the baseline information primarily focuses at that organizational system level, being name, address, MPI, primary taxonomy for each of those MPIs, phone, website, etc. And then for physicians that are employed or affiliated with each hospital or practice, that physician's name, their credentials, their MPI, and their primary taxonomy, along with the start and end date for when that physician started at that hospital or practice, or when their relationship ended with that hospital or practice. Many of you are existing users of the MHDO Hospital Data Portal, and so the browser requirements for accessing the portal that are on screen, these are the standard requirements. Nothing has changed here. When initially logging into the hospital portal, this is the homepage that you'll see. So a single user can be associated with more than one organization in the portal. If that's the case, here you would just see, two bullets or more than two listed here that were links that would take you to the respective health system that the organization is a part of. However, if you're just affiliated with one, you would see that one here. And then from there, you can go ahead and click into the organization data here in the left-hand navigation, and that brings you to this next slide. So this next slide is a high level, again, of why this data is, how it's being collected, what compliant and non-compliant means. there's some drop downs here to show the year and the status for compliance. This drop down for status changes this column here for compliance. And then it indicates all of the entities that are affiliated with that health system level. So here, for the purposes of today, we're looking at St. Mary's Health System. Health systems and parent entities can review, edit, and validate everything that's affiliated with that health system. So everything that is nested or indented underneath that health system. Whereas, hospitals are strictly responsible for validating their baseline organizational information along with any affiliated practices with that hospital. And then again, physicians that are employed or affiliated with those practices. As you'll see here, there are some a plus next to community clinical services. This allows the ability to show or hide or expand and collapse the entities that are within them. And so there's also these links at the top, collapse all, expand all. Clicking on those will just adjust that list. So clicking on expand all will basically, indent community clinical services even more and show the affiliated practices. Collapsing all just shows that, shorter streamlined list. If a plus or minus sign doesn't appear next to an entity's name, then there are no affiliated practices. And then just by default, when logging into and seeing this particular page, you'll be able to, it's by default expanded to show all of the relationships and statuses for the current year. Here's just again, just outlining the plus and minus and how that works. So right here, down here for St. Mary's Regional Medical Center, it now shows the practices that are affiliated with St. Mary's. Like I mentioned, the year status is available. When clicking on this particular dropdown, you would be able to see 2022, which again was the first year in which the validation was required for Chapter 300 organizational data. If you go ahead and click on 2022, you were able to see whether or not a practice was compliant or not compliant for that year. However, you are only able to review or make changes within the current year. So no like retroactive changes being made to a previous year. Anytime an update's being made, it's being made for that current validation process. To go ahead and begin review and verification, you can just click on review in this in the actions column. And then doing so brings you to this hospital summary page. So again, we're looking at St. Mary's. There are breadcrumbs at the top of the page, which is just a text path that shows your location within the portal. And it also acts as just a visual confirmation of the entity that's being reviewed and any affiliated relationships that they may have. Then the top of the block contains some notifications indicating, when the information was last updated and verified and by whom, like which user. Then from there, we go into some of that baseline organizational information. So again, the entity's name, their NPI, and then primary taxonomy. For each of the primary taxonomies, the description of the taxonomy is also listed. And then the address, phone, fax, website, and whether or not that facility is on CompareMain. From there, it goes into practices affiliated with the hospital, and then any physicians employed or affiliated with the hospital. And so this summary page is just that. It's the summary of all of the information for the specific entity that we're looking at. If this hospital has, or the health system hospital has unaffiliated practices, those would also show by scrolling further down the page. Clicking on edit at the top right of the summary page allows a user to make changes to a health system, a parent entity, or a hospital's information. And it brings up this particular page. So this particular form appears, it's editable except for the NPI. And so users can edit all of the information, click save, or click cancel if a mistake is being made. But after clicking save, the notification at that top of that hospital summary page that we were just looking at would be updated again to reflect that the information was just changed. To add a billing NPI associated with an entity, simply click on this link, Add NPI, on the summary page, and that will open up this particular form where the unique 10-digit billing NPI can be entered. And then there's a drop down here for primary taxonomy, where the primary taxonomy associated with that NPI can be selected. If you're unsure of what that taxonomy is, clicking on View Codes by NUCC, which is the National Uniform Claim Committee for Healthcare Provider Taxonomy Codes, that will open up so that you can go ahead and review a list, a PDF list of those taxonomies. If a MPI is not correct, you can click on Delete next to the MPI and taxonomy, which opens up this particular page, reinforcing, double checking that confirmation that you want to delete it. If you do, obviously you click yes, and if not, you click no. Returning to the summary page, if you click on Add Practice, you can add a practice affiliated or unaffiliated with the health system, parent entity, or hospital. And once clicking on that particular link, it opens up this form, which is very similar to the edit one that we just walked through, to where you can see, again, the name. In this case, you are able to add the MPI and the primary taxonomy, since we're adding a new practice rather than editing an existing. Enter in the address, phone, fax, website, and you can indicate whether or not that practice is on Compare Maine. Once users click Save, the information is automatically updated and added within the portal. To go ahead and if a practice is no longer affiliated or unaffiliated and needs to be deleted, simply click on this delete link in the action column, which opens up a different page than last year. And so this is one of the enhancements that was made this year, which just sort of reinforces why the practice is being deleted. So again, there's 4 choices. If I were to go ahead and click on the practice's relationship is not correct, it would go ahead and bring me to this particular page to essentially re-nest the entity or the practice. So on the screen, you can choose, why the relationship is incorrect, meaning the entity needs to be moved under a different entity. If that's the case, please enter the entity's name in this text box. Perhaps the entity is, not part of the health system. So in that case, that checkbox would be selected, or that individual providers are not employed or affiliated with the entity. And then you can go ahead and add in comments. The comments field is a required field. And so add in a couple comments in terms of, why this practice needs to be re-nested. And then from there, clicking on Submit will go ahead and send that information to the MHDO help desk. And then from there, the MHDO help desk will either re-nest the entity as described within the form, or reach out with any questions or clarifications prior to going ahead and re-nesting that particular entity. Another option for deleting a practice was if it was duplicate, or if it had closed, or sorry, not closed, but was just incorrect. And so that opens up this particular page where you can just confirm that you want to delete it, and it automatically deletes it from the portal in that instance. If a practice is closed, and that option is selected from that initial screen that we walk through, users must provide the date and the reason for the closure within this particular form. So reasons for closure may include that a private practice is no longer in business, the practice was bought out by another entity, or the practice went bankrupt. Moving on from sort of the higher level entities, we're going to talk now about editing employed or affiliated physicians. So I imagine me going back to the organization summary page. You'll see the physicians there. Clicking on edit for a physician will go ahead and open up this particular screen, which just, you can choose whether or not to edit the start or end date or the physician details. Again, the start date for all physicians last year was set to 1/31/22. So if you're still seeing within the portal a physician start date of 1/31/22, you're going to want to click on the edit capabilities for editing the physician details and make those changes. So if we go ahead and click on those start date here, you can just make that change. It's a text field. Going ahead and clicking save will, save that start date automatically and you'll see it immediately within the portal. If a physician is no longer with a hospital or practice, you can go ahead and add that end date within here. It's important to note that, physicians may work with several hospitals or practices. When you're editing the start date or the end date, you're editing it specific to the hospital or practice that you're editing, not necessarily overall. So again, these dates are specific to your organization. If you were to go ahead and click on physician details, here you can adjust the physician's MPI, prefix, name, suffix, their credentials, as well as the physician's primary taxonomy. The back end of the Chapter 300 organizational portal, it's a back end repository of physicians. And so when physician details, when you click save here, you will not immediately see the changes updated within the portal. Rather, the modifications are sent to the MHDO help desk for review, confirmation, and updating. MHDO goes through and either approves or rejects the physician edits, just to ensure that the backend repository remains as accurate and up to date as possible. Once MHDO goes ahead and approves, for example, any physician edits that were made, all entities that have that physician, that physician's information would be updated across entities as part of that backend repository. Physicians can also be edited manually. So you can click on add a physician to add a physician individually. Here you can go ahead and enter their unique 10-digit rendering MPI. And from there, click on submit and you will see this particular screen in which you can enter the physician's name and again their start date. If a user enters an MPI that doesn't exist within the portal, then this particular screen for complete these details will appear. And so if you go ahead and click on that, you can complete the details for the physician. Again, clicking on submit will add the physician to the entities list of employed or affiliated physicians, and clicking cancel takes you back to that summary page. We recognize that adding and keeping physician information up to date is, likely one of the most challenging aspects within the Chapter 300 organizational requirements. And so to try and help streamline that particular process, we do have a bulk import capability. So if you click on bulk import physicians, rather than manually editing or editing each physician, you can do several at a time. And so clicking on that bulk import physicians brings up this particular screen. It's critical to follow the steps on this screen to just save time and to ensure success. So begin by clicking on the link to download the template, which this opens up a Microsoft CSV spreadsheet. Then go ahead and use that template to add physicians' MPIs and their start dates in the appropriate columns in the spreadsheet. And then it's important to format the dates as month, day, year. Next, you can go ahead and you can copy the physician's information from the spreadsheet. So once you've completed the spreadsheet, copy the information into there, paste it into this text area below, and then you can go ahead and click on import. Upon clicking import, results are shown that indicate if a physician was successfully found and added into the portal and into that separate backend repository for physicians, or if the physician wasn't found and needs to be added manually. So in addition to appearing on screen, the bulk import results are emailed to you as the user just for convenience and confirmation. I know sometimes when we go ahead and click save after doing the bulk import, it's like, did that actually happen? So that email that you'll receive will just serve as confirmation of that. Clicking on add manually, if a physician wasn't found and needs to be added manually, clicking on this will open up a new browser window where the physician details can be added. Again, following the same process that we've already walked through in terms of the information to enter for a physician. Again, MPI, taxonomy, name, and credentials. Once you have completed that, you go ahead and click on save, and then you can return back to the bulk import results. So that's how we can, again, add physicians to the portal. Also, if there are a lot of updates that need to be made to physicians, that's also a really good place to, edit physicians in bulk. As we mentioned, one of the other big enhancements that we made this year to the portal is the ability to request a deadline extension. And so to comply with this year's reporting requirements, as Karen Lee mentioned, the data must be validated by May 31st. If that date is just not going to work with you, you can go ahead and click on this link, request an extension. Doing so will open up this particular form to, again, it indicates the entity that the extension is being requested for, the year, the requested expiration date or date for that extension, and then the reason in terms of why the extension is being requested. Upon clicking save, the extension date will be added to as pending approval. In this verification area, it will be added as pending approval, and then MHDO will review that request. Upon approval or rejection of the extension request, all users that are affiliated with the health system and or the parent entity will be notified if MHDO approved or rejected that extension request. And then the date will be updated up here as well. So rather than saying request an extension, it will say that it's approved and list that extension date in red. Upon reviewing the accuracy of the entity's information, including the employed or affiliated physicians, as a user, you can go ahead and click on verify. Doing so is like that next step in terms of the compliance with Chapter 300 organization. This particular pop-up will appear on screen, and you're just attesting that the information is displayed accurately, that it's complete, including the MPIs and primary taxonomies for each entity. So clicking on OK will turn the status from not compliant to compliant for the entity and or health system. There's a lot of details and features, I think, within Chapter 300 organization data. I acknowledge that it's probably challenging to see, details within the screenshots on screen here today. So the best way to obviously see that is to go in and update and review and validate the information. But there's also a user manual within the portal, along with a FAQ, and there will be the webinar from today. Both the slides and the recording will be accessible both within the portal as well as on the MHDO website. And so the user manual really talks through a lot of the instructions, details, provides those screenshots, a really comprehensive guide. So if this is, maybe you're new to doing Chapter 300 validation, that would be a great place to start with any questions. if questions still exist, obviously, certainly reach out to the MHDO help desk with any questions. So just in terms of, again, timing and next steps. So logging into the portal, making sure that you're seeing the information that you believe you should be seeing. If you think that you should have access to something else, then please reach out to the MHDO help desk and we can help with any of that user information also. The rule, as currently mentioned at the beginning of our time together today, is accessible through a link. The webinar FAQs user manual will be there as well. I'm just going to reiterate again, the May 31st is the when the validation is required for this particular year. And then starting in June is when MHDO will be starting the review and assessment of the validated information for both entities as well as physicians within the portal. And so when MHDO does their review and assessment, again, it's MHDO is looking at, does the name of the entity appear accurate? Is there an MPI in primary taxonomy associated with each entity? Does a physician start date, is it something other than 1/31/22? Not that a physician couldn't start on that date, but several physicians affiliated with a practice wouldn't have that same one. So those are a few of the checks that the MHDO does. Again, MHDO will reach out with any questions or updates that are needed during that validation process. We mentioned the MHDO help desk a few times throughout our time together today. And again, that help desk is available for technical and system issues that you might experience and to help just in completing any of the information that you may have. We provide support during regular business hours, Monday through Friday. And you can expect to receive at least initial acknowledgement of your email or a call back within 2 hours. Sometimes it requires us to look into something, and so the issue may not be resolved within 2 hours, but it'll at least be acknowledged. So there's great support there should you need it. With that, we'll, I don't see any particular questions within the chat.
So let's, Melissa, thank you so much. I've been monitoring the chat and there are no questions. So if folks, we don't have, I think we can manage it. If folks want to take themselves off mute and ask a question, we are happy to answer those for you. And while you're thinking about a question, I just want to say that a lot of hopefully the improvements that we've made in the functionality of the portal was based on feedback from you all or from many of you through the first process. So we thank you for that. And I think that that's, sort of our MO is, we build these things out and then with feedback and time, they get better and easier to use. So keep sharing your feedback with us because our goal is, again, to try and streamline the administrative burden. We know you've got a lot of other things to do. Okay, so there is a question, and that is, will this reporting be for fiscal year 2022 or as of 5/31/23? And the person asking, this is their first year doing this work. So I'm Melissa and Deb, Kim, do you guys want to respond?
So the reporting for Chapter 300 organizational data is for the point in time in which you are updating that information. And so one of the things about the organizational information and the provider directory that it feeds into is that we acknowledge that things are constantly, changing and evolving. And so it's as of that particular time in which you are validating the information, not necessarily for a specific fiscal year. Rather, the year that we have up there for the drop down is strictly for the validation year, the reporting year. But again, if you are going ahead and, updating it May 15th, then it would be as of that point in time.
So, Melissa, just to underscore that, bottom line, it's the updates that you're making are as of the date you are updating the information or validating it. So if you're doing it on May 15th, as you just said, Melissa, it would be as of May 15th.
Exactly.
Okay, are there any other questions?
Carolyn, this is, I just wanted to add that right up the point of knowing that there is so much information to update, especially annually, that we do want to suggest that it might be a good idea to update the system sooner than annually. System is always there and available, and specifically the physician information on new physicians or physicians that leave. So just want to throw that out.
And Kim, you were a little bit hard to, at least for me to hear, so I'm going to repeat that. And I think what you were saying is, we would recommend that as changes occur throughout the year, if you go in and make those changes as they occur, it'll make the annual validation a lot easier. And so we're encouraging that. And Kim, thank you. That's a really good point and an important one. All right, are there any other comments or questions? I don't want to keep folks longer than needed, but want to make sure we give everybody a chance to either ask a question or make a comment. Okay. Seeing nothing in the chat, and I don't think anybody's trying to unmute themselves. I'm going to thank all of you again for taking time to be here today. We will post, as Melissa said, this deck along. I think we're recording this and the supporting documentation on the website. And if you have questions, please do not hesitate to reach out to us. Again, thank you for your time this afternoon and your attention to this deadline and providing us with the information. And on that, we will call it.